The Senior Rehab podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. The show is also sponsored by you, the listener. Go to seniorrehabproject.com/join to find out how you can help steer the direction of this movement and join our monthly meetup. Once again, that is seniorrehabproject.com/join. Hit me.
Welcome to the Senior Rehab Podcast.
The podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, friends. Welcome to the Senior Rehab Podcast. This is not Joe Daniels. This is Dustin Jones. I'm sorry to let you down, but Joe is busy moving and starting his geriatric residency. So he just graduated PT school, or is about to, and he's going to be moving down to Florida. So I'm going to do this week's short, and I'm very excited because it's an article that I've been wanting to read for a really long time. But before we jump into it, I want you to consider filling out the survey, seniorrehabproject.com/survey, 3 to 5 minutes, 10 questions. And if you fill it out, you'll get a chance to win an old redefined mug. It's an awesome design that you will be reminded of how to fight ageism with every sip of coffee. But go to seniorrehabproject.com/survey and fill out that information, or fill out the questions. The information is being gathered to help direct the direction of this podcast, of this movement, of how we're going to maximize our time, the technology, and the collective knowledge, wisdom, and power of this group of motivated clinicians to better serve our profession. I actually just got off the monthly meetup call with the Patreons. If you want to know more about that, that's seniorrehabproject.com/join. But there's a group of us that talked about some of the preliminative data that we've been collecting and how we're going to take that and implement your feedback and make this better to serve you and your needs and our profession's needs. So it's pretty exciting stuff, but we need more input. So go to seniorrehabproject.com/survey to find that. A link will be in the show notes as well. So physiologicalpt.com, Interventions Are Not Identities is the post I'm willing to read. It is written by Kenny Venere. He's a home health PT out in Utah. Great guy. I got to spend a good bit of time with him at CSM this past year. Him and Kyle Ridgway are good buddies, and they do some amazing writing, and I really appreciate how they think, and just their critical thinking has been really helpful for me, and they're fun to have a beer with as well, so that doesn't hurt. So Interventions Are Not Identities, written November 12th, 2016. Physical therapy is a profession that struggles with identity. Not only do patients have a limited understanding of what exactly a physical therapist does, but physical therapists themselves have difficulty defining what makes a physical therapist. This identity crisis is a multifaceted issue, but one of primary contributors is the idea of defining the physical therapy profession with particular interventions. The argument that physical therapy does not have an identity outside of interventions such as exercise is not an argument worth making. This is because the profession should not be trying to identify itself with particular interventions at all, exercise or otherwise. The identity of physical therapy should instead be defined by the education, clinical processes, impact on healthcare, and dedication to science that embodies the profession. A particular treatment or set of interventions cannot possibly capture this. What is often seen is this identity crisis brought about when individuals critique the benefits, use, or relevance of certain interventions and fringe treatments. Well, if we don't have therapeutic cabbage rubbing and all we do is exercise people, what makes us different than personal trainers? As if treatments such as therapeutic cabbage rubbing or the new modality du jour are somehow essential to what a physical therapist is, what a physical therapist accomplishes, or defining a physical therapist's value. Side note, if you're wondering what in the world is with therapeutic cabbage rubbing, it's a theme on Kenny's blog. So if you read more of his posts, you'll get the gist of that. But he continues on. What is ironic is that most of the treatments or products indirectly argued to be an essential part of a physical therapist's identity are hardly unique to physical therapy. Not too long ago, Kyle Ridgway shared this excerpt from a Farnham Street post with me, which I think is wholly relevant to the idea of physical therapists associating interventions with identity. Ever notice how some businesses will add one feature on top of another to their products but fail at basic customer service? So you leave, never to return? That's a business that thinks it's in an additive system when they really need to be resolving the big fat zero in the middle of the equation instead of adding more stuff. When the profession overemphasizes ancillary treatments, novel, but often ultimately useless modalities, and other additive products as somehow being essential to physical therapy's professional identity, while failing to improve the critical thinking, scientific literacy, and understanding of the complexities of who and what a physical therapist works with, the profession misses the point. Physical therapy should focus less on adopting the latest trendy treatment or cure-all proprietary system and instead dedicate itself to refining the basics, which serve as the foundation of the profession and allow the profession to succeed in a wide variety of settings. A commitment to evidence-based practice, well-reasoned utilization of low-risk, conservative treatments grounded in science, patient-centered communication, therapeutic alliance, and being part of an interdisciplinary team. Physical therapists are uniquely positioned to drive significant change in healthcare across a wide span of populations, whether it be improving physical outcomes in post-critical illness, reducing the risk for hospital readmissions or falls, providing more cost-effective musculoskeletal care, decreasing complications after severe burn injury, promoting fulfilling lives after spinal cord injury, enhancing physical function in patients undergoing chemotherapy, or helping limiting the need for riskier and more invasive procedures in chronic pain. The impact of physical therapy can and should be far-reaching, not because of any specific intervention physical therapists do or do not use, but because of the sound clinical process employed by physical therapists. Surely other professions might use interventions that physical therapists leverage. Exercise is certainly not unique, nor is education, modalities, biomechanics, or manual therapy. But chiropractors do not work in pediatric oncology units. Personal trainers are not coaching people after knee replacement on post-op day zero. This is not because these professions do not have value, are not adequate at prescribing exercise, or performing any other intervention within their scope of practice, but it is the foundational knowledge, extensive training in different healthcare venues, and expertise that separates physical therapy from other professions and allows physical therapists to thrive throughout the spectrum of healthcare. As a home health physical therapist, my role and identity is simple. My job exists in order to help individuals with various pathologies and associated deficits safely thrive in their home environment and ultimately reintegrate into their community. In more detail, I play a significant role in working to reduce the risk for things like complications after major surgery, falls, medication complications stemming from polypharmacy or missed drug interactions, and further loss of function or independence while working to transition patients to the next level of care as quickly and safely as possible. I primarily accomplish these things by facilitating movement and providing education based off an in-depth understanding of how my patients' individual circumstances, physiology, and pathology affect their ability to live safely in their home. Note that I did not mention specific exercise approaches, manual therapy, assistive device training, pain science education, taping, needling, therapeutic cabbage rubbing, cupping, or whatever other modality you can think of. What allows me to accomplish my role and my goals as a home health physical therapist are not particular products, but a process that is built upon a foundation of science, critical thinking, clinical training, and the commitment to being part of an interdisciplinary team. If there is an identity crisis in physical therapy, it is one physical therapists have manufactured themselves in part by attempting to define their identity with particular interventions rather than working to refine the foundational aspects of the profession that allow physical therapists to succeed throughout diverse settings and populations. Physical therapists have a remarkable skill set. To attempt to define the profession with a particular batch of tools does physical therapy and the people seeking their care a remarkable disservice. Thanks, Kenny. Hit me! Thank you for listening to the Senior Rehab Podcast. I appreciate your time, and if you enjoyed this episode, do me one favor. Share it with one other person that would benefit. Thank you. If you want to see the show notes or find more episodes, just go to seniorrehabproject.com. And until next time, my friends, do not forget to stay funky. The Senior Rehab Podcast is sponsored by Great Seminars and Books. If you need high-quality geriatric con ed that's worth your time and money, check out Great. Owned by the living legend Carol Lewis, Great offers courses and products created by recognized leaders in geriatrics. Learn the most effective techniques for diagnosing and treating your patients. Just go to seniorrehabproject.com/great and get $25 off by using the code SRP25. The show is also sponsored by you, the listener. Go to seniorrehabproject.com/join to find out how you can help steer the direction of this movement and join our monthly meetup. Once again, that is seniorrehabproject.com/join.